Now, there are signs that the COVID-19 outbreak is easing in China. The number of new deaths continues to decline. 29 more fatalities have been reported today. That's the lowest daily figure since January.
And the total death toll is 2,744. However, the number of infections has risen slightly from 406 yesterday to 433 today. A new cluster has been reported in Beijing, where 10 cases have been confirmed at a property management agency.
Nearly 78,500 people have been diagnosed in China. A senior government medical advisor, Yong believes the virus will be contained by the end of April. And he notes a drug used against malaria has proven effective, with patients testing negative for the virus after around 4 days.
Dale Fisher is Professor of Medicine at the Yulu Lin School of Medicine. He's also the chair of the Global Outbreak Alert and Response Network at the World Health Organization. Thank you very much, Professor Fisher, for joining us. The US and Australia, they are convinced that we could now be facing a pandemic, whereas the WHO has said that, we're not facing a pandemic just yet. What's going on here?
I think we're arguing over semantics a little bit. There's containment doesn't mean that the virus can be completely stopped. Pandemic is a word generally reserved for free-flowing community spread. So I think everyone would agree there's no free-flowing community spread, but will it happen? It's highly likely. The ambitions at the moment of containment, as I've said many times before, are to flatten that epidemic curve so that as people get infected, we don't get too many infected at the same time. So it's a controlled spread so that health services can manage.
Well, saying that, we are seeing a large number of infections outside of China, especially in South Korea, Italy and Iran. That's 3 different continents. What's happened?
What's happened is what one would expect. This is transmitted early on in the disease. It can be carried by people while they're still incubating. These people travel because we live in one world. We expected the numbers to come down in China because of the incredible efforts they've undertaken to suppress transmission. So it really was a matter of time until transmissions happened elsewhere were more than those happening in China. So really we're not surprised. The question really is how well will the newly affected countries cope? If it runs out of control, you can have Wuhan type situations. That would be a pity because everyone's been warned over the last 2 months or a little less. So we don't want another situation like Wuhan. We want control as it spreads. But it will spread. There's no doubt of that.
And just following up on that, how could other countries sort of prevent a Wuhan-like spread? You mentioned that this has been being fought in China for the last 2 months now. It wasn't like other countries in the world didn't see this sort of perhaps coming.
I don't believe most countries in the world are taking it seriously. I think this is a major concern that what people have seen happen elsewhere, that they still haven't, I guess, got the mindset that this could happen in their country. And not that it's their fault, but every country's got a responsibility to be maximally prepared. And preparedness means, can you identify a case early? Can you diagnose a case early? Can you isolate it? Do you have rigorous processes for contact tracing, quarantining? It's all the bread and butter outbreak response efforts that countries need to be ready to roll out.
Professor Fisher, speaking of early, we're hearing first reports of recovered patients contracting the virus a second time, and that discharged patients could still be contagious. How worried, alarmed should we be?
I need to correct that. These are not, I don't think anyone's postulating that these are reinfections. So these are people that have had disease, they've been cleared, So they've got no more symptoms, and the definition of cleared, no symptoms for more than 3 days. They've had 2 swabs that are both negative 2 days, at least a day apart, and they've got radiological improvement as well. So this is quite a rigorous discharge and clearance sort of process. Now, some of these patients have had swabs a week or 2 after being discharged, and they've found they're still positive. Now, this could mean that there's a little bit of fluctuation around the negative-positive level, but we don't even know if that virus is alive, for instance. And we know many other models in disease where you can find, if you like, dead virus, because the PCR doesn't pick up whether it's alive or dead.
And has there been any progress, Professor, on clinical trials for a treatment for the virus? Oh, we do seem to have lost our connection there with Professor Dale Fisher. We will try and get him back if time permits. That was Dale Fisher, Professor of Medicine at the Yong Lin School of Medicine.